Hi, Mrs. Johnson. I'm Jason. I'm your RN today. The doctor has asked that I put indwelling catheter in you. We call it a Foley catheter. I just need to go ahead and, as I'm washing my hands, can you tell me your name and your birthday, and I'll double check your wristband? Okay, so Susan Johnson, 5/23/1973. All right. We're going to go ahead and be putting in a Foley catheter today. Do you have any questions? Okay, well, I've got my supplies here. I'm going to go ahead and bring the bed up so I can see. We're going to turn on a light. I'm going to go ahead and kind of lay the bed in a Trendelenburg position so that I can see what I need to do here, okay? We're going to be putting this Foley catheter inside your urethra in order to help with your urinary retention, hopefully get that out, okay? So I've gone ahead and washed my hands, and I've also confirmed who the patient is, and now I'm going to start my sterile field, which is going to be right here at the overbed table. In order to do that, I'm going to touch only the 1 inch perimeter of this Foley kit, and I'm first going to fold it open away from me, and then the sides, and then I'm going to pull the last one toward me, touching again that 1 inch perimeter. And as I look into my kit, I've got my gloves right here. I need to go ahead and get on my sterile gloves before I touch anything else in the kit. I'm going to use my dominant hand, which in my case happens to be the right. I'm touching only the folded cuff that's going to be against my skin as I get my hands into this glove. In this kit are a small pair of gloves. I wear an 8, and these are clearly not that, but I got that one on. Now I'm going to touch the sterile to sterile inside the cuff of the second glove, and I'm going to work that over my second hand. Again, it's not a good fit. I've got my garbage at the edge of the bed here, and I'm going to look at this fenestrated drape, which is going to go over the patient's pubis, and then this second drape, sterile drape, I'm going to use the gloves here, and I'm going to tuck it, roll it and tuck it in, and it's going to go, without allowing my sterile gloves to touch the patient's skin, I'm going to put it under their thighs near the buttocks. All right, from here as we go deeper into the kit, I'll show you I've got my swabs. I'm going to go ahead and get those open. I'm also going to go ahead and prime the catheter kit by going ahead and getting the flush attached to the hub, and also going to use this lubricating jelly, get that ready in my kit, and go ahead and let the tube, prepare the tube near the lubricating area. Now I'm going to open these swabs. I'm going to use the first one using my non-dominant hand. I'm actually going to open the labia now and pull back some so that I can see the first swab. This hand is now dirty. This swab is going to go from the front to the back, directly down the middle, and I'm going to come around my sterile field and discard the first swab, and then I'm going to take my second swab and I'm going to go to the labia on the furthest distance from me, clean that from front to back, bring it around my sterile field and discard again, and now my third swab, the labia that's closest to me, from the front to the back, and again around my field, and discard it. I've discarded my garbage. The next step is going to be for me to go ahead and lubricate the tip, making sure that I don't put my dirty hand over the sterile field. Now I've lubricated it, and Mrs. Johnson, at this point, I'm going to go ahead and put this catheter in. What I need for you to do, please, is take a deep breath and let it out nice and slowly. And as I'm doing that, I'm inspecting the area to find the urethra just above the vaginal opening, and I would go ahead and insert that approximately 6 to 8 inches on a female, and I'm seeing a flash of urine, so I know I am in. And at this point, I'm going to go ahead and inject the balloon with the saline solution, and now I pull back gently to know that it's seated properly. At this point, I can now go ahead and remove my sterile gloves. I'm going to go ahead and clean up all of my garbage that's in the area. And I'm going to go ahead and use this catheter stabilization device, which I've also pre-labeled with the patient's information and attached to the device. Go ahead and attach that with the stat lock to the patient's inner thigh. Now I'm going to go ahead and make sure that there's no dependent loops in the drainage bag. And in addition, we're going to make sure that we attach this to a hook that's designed for the urinary collection on the lower side of the bed without touching the floor, but also not hanging on any of the moving parts or the railings. At this point, I'm going to go ahead and clean up my mess. I'm going to bring the head of the bed back up to the client's preference. I'm going to go ahead and bring the bed down to a safe, to the lowest position that is safe. Put on the bed alarm, provide for the patient's comfort, ask if there are any other needs that she has, and then I'm going to perform hand hygiene and exit the room. And in both for the IV that I didn't mention and also this skill, I will then go chart appropriately in the patient's chart.